Pulp polyp may arise in connection with. This is the question. Pulp polyp may arise in connection with option A, chronic open pulpitis, option B, acute pulpitis, option C, pulp necrosis, option D, chronic periapical lesion. So let's see about what is pulp polyp. It is also known as chronic hyperplastic pulpitis. It is a productive pulpal inflammation due to an extensive carious exposure of the young pulp. This disorder is characterized by the development of the granulation tissue covered at times with epithelium and resulting for long-standing low-grade irritation. So cause, it is slow progressive carious exposure of the pulp, large open cavity, young resistant pulp, chronic low-grade stimulus. These are the cause for the pulp polyp. Symptoms, it is symptomless. There is no pain or other symptoms. Except during mastication, some amount of pain is felt. Due to the pressure of the food bolus may cause discomfort. Most common occur in children and young adults. These are the symptoms for pulp polyp. Then moving on to treatment. What could be the treatment for the pulp polyp? First, elimination of the polypoid tissue followed by the extirpation of the pulp provided that tooth can be restored. When the hyperplastic pulpal mass has been removed with the periodontal curette or spoon excavator, the bleeding can be controlled with pressure. The pulp tissue of the chamber is then completely removed and a temporary dressing is sealed in contact with the radicular pulp tissue. The radicular pulp tissue is extirpated at a later visit. If time permits, the entire procedure, pulpectomy, can be completed in a single visit. Prognosis, pulp is unfavorable. The prognosis for the tooth is favorable after endodontic treatment and adequate restoration. So we have to save the tooth. When it is favorable after the endodontic treatment and adequate restoration. Once again, we read the question, that is pulp polyp may arise in connection with option A, chronic open pulpitis, option B, acute pulpitis, option C, pulp necrosis, option D, chronic periapical lesion. What could be the answer for this question? This is the answer, chronic open pulpitis. Chronic open pulpitis.